So Alice is a course that we initiated 15 years ago. We're doing it every year and a half, and we have around a bit between 500 and 600 persons coming from 40 to 50 countries. So it's we have a delegation with 15 physicians from China, we have 10 physicians from Japan, we have colleagues from Brazil, we have colleagues from the US. Our world is small, we all know each other since a long time, so it's about sharing our thoughts and finding a way to further develop type of treatment that we're doing, sharing our problems, but sharing also our successful treatments, and this way having a lot of experienced operators. The ALICE is the acronym for Advanced Live Interventional Course of Essen, and advanced means that all the physicians that are here have more than 10 to 20 years of experience. Of course, we have some younger ones, but it allows to go into advanced things, and that's the interest of it.
Hello, I'm Takuya Moriwaki from Japan, Asahi City. I'm expecting AVM real currents and technical notes.
Dr. Ahmed Al-Qadi from Egypt. I'm the chief of the radiology department and intervention radiology department in the International Medical Center in Cairo, Egypt. I came to ALICE for the third time, and this time I would like to expect to see the more details and updates of treating AVMs, aneurysm, and venous malformation.
Hi, I am Rocío from Hospital Puerta del Mar in Cádiz, Spain, and I am still learning, so I expect to see a lot of things, especially about stroke, because maybe the other staff are a little bit advanced for me, so I'm just so happy to be here.
So the treatment that we do are all planned procedures. A few years ago, when treatment of stroke suddenly developed and was completely new, we of course transmitted stroke treatment. Today is commonly done in every place, so it's not so much at the edge of the new things, but we treat patients that have aneurysms, that have arteriovenous malformation, that have dural fistulae, that have stenosis of the intracranial vessels, that have stenosis on the veins, and all those treatments are changing amazingly fast. From outside it seems to be more or less the same, and from inside you realize that the techniques that we use today are completely different than the one from 10 years ago, which are different from the one from 20 years ago. And sharing this knowledge is something important for us.
I'm very excited to be here to look at René Chapot and all his fancy things he's doing, and I'm hoping to have interest days. The most interesting part for me is aneurysm treating with flow diverters and coilings, and he's doing advanced cases, so it's very interesting for me to see how he is doing these things.
My name is Shinya Hagiwara. I'm a Japanese neurointerventionist. I'm interested in, especially for AVM, so I learned a lot of AVM here in the ALICE session. So he showed me always a good and super nice session.
Hello, my name is Sean O'Reilly. I come from the Royal Victoria Hospital in Belfast. I'm an interventional neuroradiologist, so I've come here to the course today to try and learn from the best, René Chapot, and see some interesting ideas and things that we can bring to my own practice back in Belfast. Certainly the more complex interventions like AVM treatment, particularly transvenous AVM treatment. And also I'm looking forward to the session on problems and how to overcome them, just so that we always have ideas in our armory of how to try and fix complications.
Sharing a complication is something almost intimate. It hurts terribly for each operator to show that he failed or the technique failed, at least to share that the patient was harmed, and this is an issue. And you realize when you look at others' complication that the complication you have, you're not the only one to have. There are specific situations where a given constellation brings to a complication. So experience is not to be transmitted. This does not work. But if you see someone having a problem and you had it too, then you realize that it's multifactorial. It's not necessarily you, it may be the device, it may be the disease, it may be the indication here which is not good, and it's a way to avoid those issues to come again.
I'm Marco Politi. I work in Italy, in Sicily, in a neuroradiology department. So we are very excited to be here at ELIS 2025, and we have just seen some very interesting cases this morning, and we are very eager to see some more difficult cases and the way to plan them and to solve them. So thank you very much.
Ja, Moritz Kronlage, ich komme aus Bonn und bin gespannt auf interessante Fälle. Immer toll zu sehen, was es hier an Live-Cases gibt und beeindruckend, was wir gerade schon gesehen haben. Bin gespannt, was noch kommt. Ja, ist auch toll, dass man hier viele internationale Kollegen trifft und natürlich auch immer aus Deutschland auch einige bekannte Gesichter, die man hier mal wieder sieht.
Hello, my name is Yang Bo and I'm from China. So I'm very happy to join this academic conference.
We have new embolic agents that are coming, some that lose their radio opacity with time. When you inject a lot of things, you lose progressively understanding because it's too dark. And after a while, if the new embolic agent lose their radio opacity, we'll be able to see what's going on. A lot of materials are changing, a lot of techniques are changing. Robotics, it's still the beginning. Robotics are going on, but it's very basic. So to treat very, very simple diseases, we want to work on the other edge, the most advanced and developed things where it does not play a role. AI will play a role at some point, not today, but we're developing also in collaboration with the industry and with the imaging partners. Siemens here plays an important role. We're working on different projects and we're happy to present those for the future ELIS.